There's two major ways to reconstruct breasts following mastectomy, which is the removal of the glandular portion of the breast. The ones that use implants, which is still the most commonly performed procedure in the country, and the one that do not use implant, instead use your own tissue in the form of what we call a flap.
When patients come in to discuss reconstruction, and particularly what type of reconstruction they want, we always explain to them that there's a little bit of an algorithm that helps us move down one path or another. In particular, if someone has had radiation in advance, then they're always going to have some type of reconstruction that involves using their own tissue, which we call autologous reconstruction. Factors that come up often in that conversation and maybe help to steer their decision-making process is the fact that having natural tissue, having their own tissue, is the closest thing to sort of match what was removed. You know, in the world of reconstruction, whether it's head, neck, or in this case breast, in the perfect world, we want to replace like for like, and so abdominal tissue and the fat tissue in particular that gets transferred with it is very similar to the breast tissue that's removed. So for the patient, it's a very living, natural tissue. The second thing that is extremely important to them is that when we can use their own tissue, it's a very permanent solution. So for someone, regardless of age, but in particular if they're a younger patient, then the idea of having an operation that might take from 9 to 12 months, maybe from start to finish, but then never have to have any other procedure for reconstruction and to be literally finished with their reconstruction after that for the rest of their life is extremely attractive to them.
Certainly the recovery might be a little bit more difficult, but you have to think that this is, once completed, it's done forever. There's no need for maintenance as you have for the implant-based reconstruction. In addition, the feel of the reconstruction and the avoidance of a foreign body, which is an implant, provide a better comfort for the patient. The deep flap reconstruction is a natural restoration of the breast.